Good evening, students. So I welcome you all to the DAMS MDS Career Counseling. And along with me, we have our periodontics faculty, Kapil Singhal sir, and we have our cons endo faculty, Nitin Kararia sir over here. They have joined to help clear your doubts, your questions that you have. So let's start this session. I had received a few questions from all of you, and so I'll give you all a chance one by one to ask your questions. All right, you can unmute yourself, you can ask your questions, and accordingly, sir, both the sirs along with me, we will be answering your queries. All right. All right, so I'll be calling out your names one by one. You can unmute yourself and ask your questions. All right. Khushi, you can please unmute yourself, ask your question to us.
Hello, good evening, ma'am.
Good evening, Khushi.
Ma'am, actually, I wanted to ask about ortho colleges. Which college is best for ortho?
Okay, Dr. Rijul will be joining us shortly. All right, once Dr. Rijul joins in, then I'll ask you to ask your question again. Okay?
Okay.
Yeah, Bhavna, you can unmute yourself and ask your question. Bhavna, are you there? You can ask your question. You can either unmute yourself or drop your questions in the comment section, Bhavna. You're not audible. Bhavna, you're not audible. Bhavna, please unmute and let us know your question. I think there is some audio issue, Bhavna, at your end. I'll just go on to the next student. I'll come back to you later. Dental Bud Polyclinic, please unmute yourself and ask your question.
Hello, ma'am.
Hello.
Good evening.
Good evening.
Ma'am, I asked for the maxillofacial surgery in future. Actually, I am confusing about where I am taking in endo or maxillofacial or prosto.
Okay.
But my first desire is maxillofacial. But
Okay.
some seniors are saying that there is a long struggle and all this.
So
Then
regarding
after that,
endo, I will ask Nitin Kararia sir to answer your doubt first, then I'll answer later. Okay?
Okay, ma'am.
Good evening, everyone. I think I am audible.
Good evening, sir. Yes, sir, you're audible.
Good evening, students. Am I audible right now?
Yes, sir, you're audible, sir.
Okay, great. First of all, congratulations to all the rankers who have successfully secured good ranks. And specifically, what is the question, Dental Bud, you want to know about cons and endo? Please let me know.
Dental Bud, please unmute yourself and ask specific question regarding endo to Nitin,
Yes.
sir.
Hello.
What do you want to know about my specialty? Please let me know.
Sir, I am confused about which branch I am taking. Actually, my desire is taking maxillofacial, but our seniors are taking that. They are after taking maxillofacial, they are long time to struggle or competition with general surgeon in any hospital. No hospital giving regular consultancy like in except associate professor or all that in max to max in 25,000 they get paid after doing maxillofacial. So and in they said that in most of the clinic cases you get 80% from the endo, that is RCT and composite on all that. So I am confusing about which branch I am taking, either endo, prosto or maxillofacial.
Okay, great. I understood your dilemma, and which is very natural for a student like you to have it. See, first of all, I would say that each and every specialty has its own importance. It is not like some branch is better than the other, or the opportunities are not there for one particular branch and it is there for the other branch. So I would say there are equal opportunities, almost equal opportunities for all the branches. The first thing that should come to your mind is your personal choice. Okay, you have slogged so hard to get a secure rank in NEET, and you should not be swayed by what others opinion is regarding a particular branch. If you are interested in doing oral surgery, you should go for oral surgery because it is a good branch. Surgical exposure is there. A lot of cases are there. It is not like that you would be associated and you would be stuck to a particular amount of salary or like this. It is not like that. Secondly, yes, of course, if you look at the general scenario as the number of patients turning up in any OPD regarding dental procedures, then definitely in day-to-day practice, you would be dealing with more cases of root canals, more cases of restorative dentistry, and more cases of other procedures. But it is not like that. Obviously, in a clinical setup, you would not be doing complex surgical procedures till the time you have a full backup and full setup. And it is not like that people are not doing surgery at their clinical setups or something like that. So if you are interested in going for surgery, go for it. Yes, day-to-day practice, consul endo, perio, all of the branches, whatever are there in dentistry, I would say they have got equal opportunities. So please do not be confused. At this time, what is most important for you, that you have to go by your choice. Secondly, you not only by the choice, at times you are happening when you sit for the counseling, you have a choice of colleges. So that is very much important that you select a particular college which is having a handsome OPD, so that whatever branch you are doing PG with, you get a good clinical exposure that would give you confidence in your future endeavors. I think that is my opinion about this.
Okay, dental bud, like
Anything else you
regarding,
want to know?
But, sir, if I take maxillofacial, which college will be the better for me? My rank is 896. So
Yes.
in this rank, I want in my state, but in government college, not get, I think so. So I have to go for private college or either in private college state government quota seat.
Dear, why do you want to
So
pursue PG in your state only and compromise upon the clinical exposure?
because sir, in my clinic is in my state. So if I go to the outer state, my clinic will be shut down or something. In any juniors, I am taken in 3 years, higher 3 years. They will. The last time I also not taking my rank in last year is 756, but I am not taking. But this year. I am confusing also. Some other said that drop 1 years and you under 200 rank you must get, and it will be better for you get at least in AIIMS in Kolkata. Or and if I go to the other state like in Bhubaneswar, I get I think so SCV or any other state in Patna dental college. I get, but other state it will be difficult for me because clinic is patient exposure is more in my clinic right now, but that will be because my father's is passed away in 2 years back, so I have to. I am the only one better. So
I
this
understand.
is
Yeah.
the
Okay. See, it is entirely means everyone's situation is different. You have to look at different fronts. But ultimately, when you are pursuing PG, especially in a clinical branch, clinical exposure is must, and that would come only with the number of patients, the variety of patients that you would be doing in your 3-year tenure. So again, I would stress that if at all possible, you look at the options available to you according to the rank that you have secured at the time of counseling, and go for the college, whether it is government or private, which has got a handsome OPD that you can always go and check and have a review from some of the previous students that have passed out from that college, because that I personally believe that clinical exposure is must. That only would give you confidence in your future endeavors. Okay, so please do not compromise upon your clinical exposure, and that would come only with the number of patients that you are treating per day.
Sir, one thing I want to add that in my clinic, I am now also stuck in upper posterior RCT like CSF canal also, and I called to my senior or for consultancy in endo also and veneers in other cases. So I also confused that if I take an endo, so I am good. No person I have to call after that, and if I take oral surgery. So good for any infection and all these cases. So I am confusing the branch also, and prosto Some others say that prosto is the good opportunity you can get. So I'm so confusing situation, sir.
See. Being in dilemma would not help you. Ultimately, you'll have to make a choice. Okay. At times, what happens when you go for the counseling, you have got very limited choices. No matter you may be aspiring to go for 3 or 4 branches in your mind, but when your rank comes and your number comes, you have got just 2 options in your hand. So you have to be very, very clear that whatever you want to pursue, you have to be clear that this is the option I have to choose from. And that would be possible only when you are clear about your choices, ranking 1, 2, 3, and 4. Just like you solve your MCQs, like that only you should be clear in your mind that what all branches you want to pursue. Okay, so being in confusion would not help you out. And secondly, what you are telling about that whatever you may be doing in your private practice till now, you may be doing root canals, you may be placing implants, you may be doing braces, etc. But that does not mean that your knowledge is at par with someone who has done post-graduation with good academic and clinical exposure. Okay, that would definitely help you out in enhancing your clinical skills and your confidence in treating the variety of patients. I hope I am clear with what I want to convey to you.
Yes, sir.
Are you connected? Yes? Okay. So please make a wise decision, informed decision. Okay. It is just a matter of 3 years. If you want to move out from your home place, you should, if you're getting a good college with good clinical exposure.
Sir, can you suggest good colleges in
See,
good
there are
colleges?
so many colleges. In India, there are close to 300 colleges offering MDS. Okay.
Sir,
So it is not like
can
which colleges.
you give the listed that in low rank I can get a government seat that colleges?
I think that is that we can better tell you when we know that what our options are available to you. I think other faculty also would concerned with me this in this regard, that how can we suggest that one particular college is good about this?
Yes,
Isn't
for
it?
that, yes, sir. For that, we'll have to know the seat matrix
Yes.
and the pattern.
Yes.
I think the seat matrix is not out as yet.
Yeah.
And the pattern of the, seat allotment, which has taken place last year.
Obviously.
All right. I hope, Dental Bud, your doubts are clear now.
Yes, ma'am.
Okay. Khushi, are you there? Dr. Rijul has joined. You were specifically asking regarding ortho. You can please unmute and ask your doubts to Dr. Rijul.
Yes, please ask.
You can also please switch on your video. We'd like to interact on a more personalized level with all of you because we have barely seen all of you during our teaching schedule over the past year. So I also may request you to kindly switch on your video if possible. Khushi, please ask your question.
Yeah, I wanted to ask about ortho college. Which college is best for ortho regarding having best OPD, patient flow?
So that's जैसे कि as sir told you, it all depends on your rank. Somebody also some few days back after the result only they asked me about this question. He said, what are the best colleges? So in North, if you prefer, I'll exclude the INI colleges. In North, if you prefer, it's PGI Rohtak has a very good OPD. Maulana Azad is very good OPD. And down South, the OPD, if you go to any, like in Karnataka, Chennai, Savita Dental College and all, they have a very good OPD. Now the type of malocclusions and type of patients you get differ a lot. So in down south, if you go, you'll get a more of a syndromic cases. They're extreme malocclusion kind of cases. So it also depends on where you wish to practice post your PG. If you do want to do it down south only, then I would say recommend you to do it your post graduation there only, because the kind of exposure and kind of patients you get there the kind of malocclusions is totally different from the one which you get in the North Indian setup. Okay, so the OPD thing is, yes, as sir told, is the primary thing which should be there because it will only provide you with the kind of exposure, okay, and it will only help you in that. But if it also should depend if you got a good rank and your seat matrix gives you that option of choosing between a north and a south college. Your practice, your what you want to do post your 3 years post graduation, it should also depend on that as well. Okay, so I hope I answered your question. Khushi, yes.
Yes, sir. So, and I also wanted to ask, like I am confused between ortho and endo, but mostly I am inclined towards ortho. Like I have asked many dentists about that, whether I should go for ortho or endo. I'm inclined towards ortho, but many are saying that ortho is male oriented. It's you have to go for consultations to different places and all. So what should I take, sir?
मेल एंड फीमेल ओरिएंटेड तो मैं कमेंट नहीं कर पाऊंगा. हाँ, ऑर्थोडोंटिक्स में ये इश्यूज है कि यू रिक्वायर टू गो टू अ लॉट ऑफ कंसल्टेशंस इफ यू वांट टू गेट एक्सपोज बिकॉज right now, like you can see in my background, I'm traveling only in a car. So I'm coming from a consult and going someplace else. So that's the issue with orthodontics because endo, prosto is all a bread and butter kind of a thing. You must know. And orthodontic is a subject which is you can say additional and top of things. Because hardly during a graduation days anyone would have done any ortho cases. You just used to do a removable cases, simple Holly's plate, closing space and all that. Okay, so anyone starts his practice requires an ortho consultant to visit to assist them in cases. And what an orthodontist can do, no one else can do that. Okay, so I thought it like that way. Okay, so हाँ, मेल फीमेल का तो ऐसा इशू नहीं है because in my college, although it was not through NEET, there we had more females as compared to males. Okay, but हाँ, ये इशू अगर आगे जाके हाँ आपको ट्रैवलिंग में इशू है and looking at the scenario which city because orthodontics is more inclined towards tier 1, tier 2 cities. There you get a more good patients, good amount of quality patients who like to, like you want to go for aligners like अब जैसे अब down the lines right now only aligners पे ज़्यादा focus आ गया in which ज़्यादा visiting required नहीं है. You just give the aligners and you can see them after 3-4 months as well. But हाँ, visiting is required. And ortho में ऐसा भी नहीं है कि in you one go you get a good amount. 1 patient, 2, 3 patients जैसे जैसे आते हैं. So per patient per visit you get that amount and you get a corpus amount अगर आप money wise सोच रहे. So हाँ, good paying branch है, but हाँ, requires travel and requires efforts from your side as well.
So, sir, due to aligners, is ortho branch gonna end soon or something like that?
नहीं, उल्टा हुआ है भाई. अलाइनर से पॉपुलैरिटी थोड़ी बढ़ गई है इस समय बिकॉज अर्लियर लोगों को कम पता था इस रिगार्डिंग ऑर्थोडोंटिक ट्रीटमेंट. दिस थिंग बहुत लॉन्ग टर्म ट्रीटमेंट है, बहुत पेनफुल ट्रीटमेंट एंड ऑल. बट अलाइनर्स ने इतनी एडवर्टीजमेंट करके इतनी ज्यादा तो एवरीवन लाइक आपने अभी पूछ लिया अलाइनर्स की वजह से एवरीवन नोज व्हाट orthodontics is and why it's required. Now it has become sort of a necessity for everyone. Now everyone wants to get an orthodontic treatment done. Okay, so उससे popularity बहुत ज्यादा spurt out हो गई है aligners की वजह से. Earlier it was not so much. So it's like similar kind of thing कि जैसे आपने अपने there's a tooth vaccine which is being searched, so उससे cavities नहीं लगेगी. There's a regenerative stem cell research हो रहा है जिससे teeth regrow हो जाएंगे. So it's like that kind of a thing. So whatever you say, जब मैंने अपने शायद लेक्चर में बताया था, with time malocclusion का prevalence बढ़ता ही जाता है because of your dietary habits. If you remember the first slide which I discussed, classic etiology of malocclusion में, malocclusion का prevalence is going to increase and will keep on increasing because of your dietary habits, all your growth patterns, environmental causes, इतना ये सब. तो malocclusion तो बढ़ता ही रहेगा, तो बढ़ता ही जाएगा. हाँ, बट ये है कि अलाइनर्स की वजह से पॉपुलैरिटी भी बढ़ी है. हाँ, इट हैज कॉज मार्केट डिस्रप्शन बिकॉज ऑफ एट होम, बट उसके लिए भी दे आर वर्किंग. लाइक बाहर की कंट्रीज में तो काफी स्ट्रिक्ट लॉज आ चुके हैं एंड दे आर ट्राइंग टू रेप्लिकेट इट हियर एज वेल. अगर इफ यू वुड हैव गॉन डेंटल काउंसिल की तरफ से डायरेक्टिव्स इशूड है तो पेशेंट को हाँ एक बार झटका लगता है कि वो करा लिया एट होम पे, उसका रिजल्ट नहीं आया. बट हाँ, slowly he realizes जो अगर आप good city में educated patient है, he will never go to a at home one. He knows the problems associated with it. So it also depends on the place we are practicing, what kind of, but patients increase होते हैं, बहुत increase हो गया. It's because of this only.
So like I have got 6,000 ranks, so I am getting a private college only. I don't. Then accordingly, if, should I go for state counseling or all India counseling?
You should go for both. आप कौन से state से हो, know, you never know what you get.
Sir, and which
State,
college?
because उसमें कोई harm तो है नहीं कि कौन state counseling से कुछ लोग हमारे state में होता था. Like I was from Delhi only, मौलाना आजाद से, तो we got people जो 6-7 thousand में उनको मौलाना आजाद मिल जाता था through state counseling. So you never know what you'll get through your state. So what's the harm in appearing for that?
Yes, sir. Sir, and which college for even for private college is best for ortho? If
In private colleges, you want to go, as I said, Savita is good, SGM Dharwad is good, down south, Karnataka mein. They're all good colleges, Karnataka ke around.
and in north, in Delhi, Rajasthan.
North में यार जो NCR, Delhi state में तो कोई college है नहीं. The NCR region में जो colleges है, ITS, okay. मैं नहीं कहूँगा अच्छा है, okay. Because NCR region में the problem is patient flow का थोड़ा सा issue है. I'll be honest with you. Agar if someone is from that college is joined the chat or your video right now, can tell patient issue hai. Like
Yes,
अगर आप
patient issue is there in NCR colleges.
हाँ, तो अगर जैसे मैम OS में ही बता रही है, तो OS से लाइक ब्रेड बटर की एक्सट्रैक्शन तो चाहिए ही चाहिए सबको. अगर OS में इशू है तो ऑर्थो में तो आप सोच लो कितना इश्यूज हो सकते हैं. तो देयर इज अ इशू एंड इन द एंड यू वांट कि आप if you are spending 8 hours to 10 hours in college, you want approximately 5 to 6 appointments आपकी डायरी में होने चाहिए. That's make it worthwhile कि आप 5 to 6 hours वहाँ पर spend करो. तो अगर उतने भी आपको ऑर्थो में नहीं मिल रहे तो that's a thought to be given. Down the line 3 years में कम से कम 100-150 पेशेंट्स तो ट्रीट करके निकलोगे, एकदम कॉन्फिडेंट रहोगे ना बाहर जाके ट्रीट करने में. आपको कोई कंसल्टेशन पे भी बुलाएगा, कुछ रहेगा, तो सबसे पहले दिल्ली में तो बहुत कॉमन है, दे आस्क यू कौन से कॉलेज से हो, एक्सपीरियंस बाद में पूछते हैं. So that's the issue which you will have to look into it before considering it.
So, sir, in north, you won't be recommending to go for north colleges.
In private, I won't be recommended because UP side से लेकर उत्तरा north का मुझे idea है. यहाँ उत्तराखंड में भी there is this college. What's the name of that college? I'm forgetting. It's near in Rishikesh only. वहाँ अब AIIMS भी इतने branches खोल चुका है, so they are suffering from that. And patient flow कम है. Down south patient flow अच्छा है. You go to Comet K colleges, they are very good patient flow. Like SGM Dharwad के जिसके बारे में बात की, it's very good college. Savita Dental College is very good. वहाँ तो we had some conference down in a post graduation time, so I myself saw. And very good, मतलब maintenance, मतलब even government college से भी अच्छा बनाया हुआ है मैंने. So it's a very good college.
And in Bangalore colleges?
हाँ, that's like I said, Bangalore के around जितने भी है ये, they're all good. Patient flow है वहाँ पर.
Into ortho?
हाँ, ortho. I'm thinking ortho only. Ortho में है तो बाकी सब में तो definitely हो गई.
Thank you, sir.
And I got a question, sir. I want to ask about ortho versus OS, sir, and colleges. So ortho versus OS, I said ki this you need to see. I cannot compare one branch with other. Which is better, which is worse. I cannot comment on that. Each one has its own perks and own advantages and disadvantages. So I cannot say ki this is good, this is bad. Okay. So that's what I'm saying. My drawings 1830. OBCs, can I get good college in Maharashtra? I think you can. In Maharashtra only you can get, because OBC 75 in state counseling you can get to GDC Aurangabad or GDC Nagpur. Suppose so. All depends on let the seat matrix come. And I will recommend everyone to do a pair for state counseling. Don't think that you need to compare that whether to appear it or not. Okay, so I think I answered this. सविता SDM धारवाड़ में खर्चा भी ज्यादा है सर, सस्ता कॉलेज अच्छे पेशेंट फ्लो में बता दीजिए. Again, सस्ता means you won't get a good patient flow ना. Okay, so if you want to study, then if first appear for the counseling and then you yourself should go and see that college. Okay, sir, with 40 lakh budget. Sir, Kushi, I cannot comment on the fee structure right now. Because back in time, 40 lakh was a more than sufficient budget for Savita, I think. Right now, what fee structure they are asking, I cannot comment on that. Okay. So if in NCR region also Manav Rachna is there, if you want, it's more than that, but amount of money they're asking, patient flow kam rahega. Manav Rachna mein hai, Puneet sir is there and all that. Okay, then is Gurgaon mein hai. So मैं OSN ऑर्थो के लिए प्राइवेट कॉलेज कौन से बेस्ट होंगे सर? प्राइवेट कॉलेज इन महाराष्ट्र. I need to check with that. I cannot comment on that. ऑर्थो के लिए, OS के लिए, if ma'am can tell, Sethi ma'am.
Yeah,
Ortho.
Xiaomi, for OS, if you are seeking a private college for OS, I would recommend you to look at Karnataka over Maharashtra, because Maharashtra colleges have a little less case spectrum. The case spectrum in OS in Karnataka is vast. The specialty in Karnataka is practiced very, very differently in regards to maxillofacial surgery. Now, when we discuss about maxillofacial surgery at the postgraduate level, it is not just impactions and implants. It has to be your trauma and hardcore, very advanced level trauma. It has to be oral oncology. It has to be cleft lip and palate. It has to be TMJ. It has to be orthognathic surgery. Until and unless a college is not providing you all of this exposure, then it becomes problematic, because now the trend is towards fellowship. So your fellowships basically happen in these subspecialties. So you have to figure out your aptitude amongst these, amongst advanced trauma, onco, cleft during your residency, and you'll only be able to do that in case if you're interested to go for a fellowship. Now everyone is not interested to go for a fellowship. You can have a good practice with your impactions and implants as well. But in case you're interested in a fellowship further, you want to study further, then you have to have a good exposure to all the entire spectrum of oral and maxillofacial surgery at your residency level. Because let me tell you, cancer surgeries are very extensive surgeries. All right. So in case when you don't have an exposure to, such major surgeries at your residency level, then it gets difficult to adapt to them later on post-residency. So I would prefer Karnataka colleges over Maharashtra colleges for oral surgery private.
Ma'am, some of
All right.
college,
Yes.
Karnataka के job
Sorry?
suggest करें. Ma'am, कोई
All-
Karnataka के private colleges job suggest करें.
Again, Karnataka colleges, deemed universities, I would say, again, depends on your budget entirely. JSS, STM Dharwad, CODS Davangiri, JSS Mysore, AB Shetty, AJ Shetty, Manipal. These are your deemed, and they have a slightly higher fee as compared to the rest. Apart from that, all your Comet K colleges, all the colleges in Bangalore are being headed by some very good HODs, where the case spectrum is very nice. And the Comet K colleges, the Bangalore colleges, the fee is obviously much lesser as compared to your deemed universities. I hope I've answered your doubt, Xiaomi.
Ma'am.
Okay, Bhavna, you can unmute and ask your doubt.
Okay, ma'am. Sir, my question is to Kapil, sir. Sir, what is the scope of perio if I take it from government? Because, I have got 790 rank, and with that, I don't think I would get the top branches. So, in my mind, I'm clear that I have to do it from government college, whatever the branch be. So what branch should I prefer, and what is the scope of perio Also, I was thinking about pedo. I would ask ma'am if she is available.
Okay. So yeah, Bhavna, very good evening. But first of all, I've listened to a lot of questions from the students. The first thing that you should not think right now is what should I earn? What would I earn after I take a branch? So first of all, whichever branch you take. So right now, your main focus should be to like work for next 3 years. And I have seen people from all the branches that we have in dentistry. They are working and they're doing some amazing work. And let's not talk about the amount that they're earning per month that you cannot even think of. So right now, believe me, the money should never be in your mind that which branch is good and which branch will earn a good amount of money. If you're good, if you're focused, if you've worked hard for next 3 years, every branch is very good. So now coming to your question for perio and pedo. See, both are entirely different branches. Now, most important thing, Bhavna, that you should see is what is your preference. Do you love kids? Can you handle them? If you can, it's a very good branch. I have a lot of pedo friends with those who do exclusive pedo practice and are doing very good across the country. So first see what's your interest. In perio, you have to choose a college that can give you a lot of exposure to the surgeries. Not only basic surgeries, a lot of now in perio there are a lot of new surgeries that have come up. Because what I have seen with a lot of colleges, they are not upgrading, especially the HODs are not upgrading with the latest trends. And also a lot of perio department does not have implants. So if you are choosing perio, first see whichever college you're choosing that does the HOD allow you to do all the type of surgical procedures, like a lot of mucogingival or soft tissue surgeries are there, and also the implants are there in the curriculum or not. Otherwise, the most important thing is your interest, Bhavna. I will still focus on this. If to all the students, please just go by your interest. Now, whenever you get a seat, according to your rank, you know the seat matrix. Last year, if you can see at that rank nearby, what seats are there. Now, I would advise you just according to that, see at your rank which branch you are interested and which colleges are something that you can get. So you'll get a rough idea that this is something you're looking at. So I would ask you all not to compromise with your interest, whichever branch you get, and whatever branch you get for next 3 years, give your best so that you'll excel out and be all very good with your things. Yeah.
Sir, actually, I have already compromised on my branch. So now my focus would be that whatever branch I would choose, I would give my 100% to that branch only because I can't.
I'll tell you my story. I was ranked 1 in Rajasthan. Okay, I got perio because in Rajasthan there was one government seat for general, and by roster I got perio. I had a rank in Comet, I had a rank in All India and PJ, but I don't want to leave my state because of some family issues. So believe me, it's your hard work. If you can work hard with your branch, no branch is bad. And in perio or in pedo, I can give you with my example being in perio, it's an amazing branch, and you, with respect to the aspects of work, you can do so much of good work, and with respect to the earnings, is something that you can get very good. So there's no, because a lot of time initially when I also took the perio, there was everyone was telling me that at rank 1 you've taken a perio. So you should not think like this and stop listening to people. Listen to yourself, see what do you want to take, what is your preference, and with perio and pedo both the scope is very, very good. It is just your hard work that would make the 3 years count. If you next 3 years, if you don't count it properly, whichever branch you take oral surgery, you take endo, it would not be of any benefit. I've seen so many students from so good colleges. It's your hard work that would count for next 3 years. And obviously the patient flow and other things that the other mentors have told is very important. Whenever you choose a college, look for a college along with the branch that which college has a decently good patient flow.
Sir, actually, I am planning to pursue any branch from a government college. Whatever branch I would get at my rank. Because I know I have got 790 rank, which is not a good rank. for pursuing some
It's a
great
very good
branches, which
branch.
I am
Bhavna, first
wishing.
you should. I know you have worked very hard. Please appreciate whatever you have got. Now, I would advise you according to your preferences when you fill up the seat matrix when you're filling up that seat matrix, and just choose your preference and according to your rank and according to the colleges which you prefer to take. Then whatever you rank you get, whatever college you get, that would be obviously your luck. But right now you should just focus upon the colleges, the branches that you want in the list of the colleges. So if your preference is to go with Perio, you can look for colleges at your rank which you can get at Perio. And pedo, if you're focusing on pedo also, so you can just see if some college has a better pedo as compared to perio, you can just put that over your perio. And if your preference is perio, you can just see which colleges are good for perio. So you can just work with those colleges, and then according to your rank, whatever seat you get, you'll have to work with that.
Sir, among government colleges, what would be best? Like, what should be my preference for Perio?
I'll tell you, you should fill all the colleges. Fill Maulana Azad, fill GDC Jaipur, fill all the colleges. Now you need to see when the seat matrix is there that what are the preferences, which college is best. For that, see, it's very important what I have seen with the departments, it changes every year. Because the HOD, if the old HOD has retired and the new HOD has come, the department totally changes. So it's very important that whenever you're choosing any college, especially a government college, you talk to the maybe the PGs, those who are working there, so that you get an idea of the current scenario of that college. So that would give you an idea. So right now it's important that if you're thinking about Perio and Pedo, you can just look upon, because it's very easy now to talk up to all the people, because you can find them on the social media. You can just ask them and request them for the preference and the college and the patients. So you can just look upon all the colleges that can come at your rank in government colleges in Pedo and Perio, and can approach the students. I can help you out with that if you're looking about for Perio. Perio, it's see in government colleges, if you go with PGI Rohtak, it is good. Maulana Azad is very good, but again, you have to see at your rank, you will get that or not. But it's very important. First, we need to see according to the seat rosters that what rank at your rank, with what colleges you can get. Then accordingly, we can see that what is the best way to fill it.
Yes, sir. With that, I have actually prepared my list.
Okay.
The first in the top first of all, I have placed the top colleges, the central institutes, and then I have prepared a list according to the location. The more closer the location, the more preferred would be the
I would
the
say
branch or college would be.
don't. Yeah, I think location should not be a criteria to choose a college, because once you're out of your city, it hardly matters if you are even far. You should look for colleges that are better, that can give you a better exposure as compared to a location. That's my preference and that's my advice.
Sir, can you give me an example, like if location would not be a preference,
Bhavna, you can send me the list that
what
you
should
have
be
made.
the preference?
Yeah.
How do I get the data at which branch would be best from which government college?
I think, Dr. Smithy, we need to see that seat matrix to answer this question, because every student
Yes,
has
sir.
the thing
Yes,
that
sir.
which for each branch, which colleges are the best. So we can do one thing for each branch. We can see the preferences of the colleges, and can at least some government colleges or some good private colleges, we can give them a preference so that they have an idea about that.
Yes, sir, we can definitely do that once the seat matrix is out, and we can circulate the list amongst our students.
Yeah, so at least we can do branch wise. So every faculty of each branch can look upon the colleges and can give a list of the colleges according to the sequence.
Yes, sir, definitely we'll do that, sir, once the seat matrix is out. I hope your doubts are cleared, Bhavna.
Ma'am, there is new information bulletin also. It's released just now, I guess, at around 6 o'clock. So, are there any changes? Have you had a look at it?
I still have to have a look. I'll have a look, and I'll update you all.
Okay, ma'am. Can I have a talk with Pedo, ma'am?
Ma'am is not there with us. We can arrange a call with ma'am for you.
Yeah, ma'am. I'll text her.
Sure. We'll also try arranging it from our end. All right.
Okay, okay,
I'll
ma'am.
get it
Okay,
arranged for you, Bhavna. Okay.
okay, okay, ma'am.
Yeah. Samriddhi, please unmute your mic and switch on your video and ask your question.
Good evening, ma'am.
Good evening.
Ma'am, my question was almost same as Bhavna. I got an AIR rank of 373, so I was also confused. Like I'm choosing for perio only. So I also want to know, like after 3 years, what is the scope for perio? And I'm from Uttar Pradesh, so like between KGMU, Sethi, and BHU, which is like good college for me for perio, like and where implants are like there.
So I'll ask Kapil sir to answer your question.
Which colleges have you said? I've heard BHU, the other colleges were?
KGMU and Sethi, UPUMS, Uttar Pradesh
So I know
University
about
of Medicine.
KGMU. I know about KGMU and BHU. Both have implants. KGMU, there was some juniors there, and I know through them that they're doing implants. Even BHU has implants. I've done a lecture there also. So both these colleges have implants. They're decently good colleges there for perio also.
Okay, sir.
But
Thank
again,
you so
I'll
much.
tell you, I'll advise you one more thing. But
Yes,
still,
sir.
because it's important that you check the current scenario. If you have those list of colleges that you're looking for, 3 or 4 colleges, just if you can find the seniors, the current seniors or current PG students, those who are studying there, they can give you the best in and out idea. And if you're very sure about these 3 colleges, I would even advise you to go and visit on Monday or Tuesday so that you can get an idea about the OPD and other things also about the college. So better to visit and also and to talk to the current people, current PGs working there.
So, sir, I talked to one of the PGs in BHU. They said there are implants in perio, and also in Sethi they said there are implants, but I could not connect to any senior in KGMU. So, if you can guide me if there are
I'll do
implants
that.
in perio.
I'll do that. No problem. Yeah. I know I have, there are implants in KGMU also because I've taken a lot of lectures in UP. So I know some of the doctors coming out from there, but still I'll connect you to some of the doctors, some of the PGs there in perio.
And sir, what about GDC Jaipur? Is there implants in perio in GDC Jaipur?
Yes, in GDC Jaipur there are implants. In Jaipur, what is there actually? Implants, there's a separate clinic. So perio, oral surgery, and prosto. So all the 3 specialities can do implants. If you have a patient, you can and you can take a thesis on implants also here. So if the HOD and you are ready, and if they give you a thesis on implants, like my thesis was in implants, I did my post-graduation from GDC Jaipur only. So you can, if you thesis on implants, you can do a lot of implants there also. It's a very good exposure there for implants.
So, sir, my next question was like that implants are there in 3 branches, prosto, perio, and OS. So, how do they decide that which branch PGs are going to take that particular case of implant?
It totally depends upon, suppose you have a case for chronic generalized periodontitis and you have
Yes, sir.
extracted some tooth and you can convince that patient for an implant, it's your patient. So it's like whichever department the patient has been referred for the problem. So maybe that patient has a missing tooth, has been sent to prosto. So it all depends upon that. And now what has happened, actually, the surgeries, a lot of surgeries are done by oral surgeons in perio, but the prosthetic is generally being given to the prosthetic part, to the prosthodontist in GDC Jaipur, what I know.
Okay, sir. Thank you so much.
Yep.
Okay. Shubham, please unmute yourself, switch on your video and ask your question.
Yes, ma'am. Ma'am, am I audible?
Yes, you are.
So, ma'am, in the exam, I got all India rank of 386, and I have gone through all the last 3 years of counseling data that is available on the MCC website, and by that data, I have seen that at my rank in open category, I am probably getting like 5 branches at most probably, like perio, pedo, PhD, OP, and OMR. And like if I say about my preference, it was endo, but it's might not be possible to get a endo seat in a government college at this rank. So how should I go about my uh, how should I go about like my choice filling, ma'am? Like in the future, like I want to go to a department which is close to general dentistry, like so that I can learn as much of the procedures as as that are done in a general clinic. So I am little confused about choosing the branch actually.
Okay. So again, I'll ask Kapil sir to guide you regarding your choice of branch.
See, if your focus is on general dentistry, say I'll tell you because at your rank, you, as you said, endo in a government college would be difficult. So you may get a pedo, you may get a perio or oral path or otherwise OMDR. Those are non-clinical. So if I talk about the clinical branch, you're again left with perio and pedo. So now if your focus is general dentistry, because in perio, in a lot of departments, there are endo-perio cases. You got to do a lot of endo also. And plus, what I've seen and learned with perio is that your diagnosis part becomes very good. When you see a case as a whole, because when a patient of perio comes, he has a lot of issues and your diagnosis part will become very good. And with time, your treatment protocols, because you're doing your extractions also there and you're doing your implants also, so your surgical skills becomes better. You're doing, if your department is allowing you to do endo-perio cases, like we used to do a lot of endo also in our department. So your endo becomes also decently good. And see, if your focus is general dentistry, right now I'm answering according to that. With time, when you're into your practice, your rest of the endo work and rest of the works, you with time you can get to do some other fellowship programs and other programs and can still learn. But for me, if your focus is a general dentistry, your preference branch would be perio as compared to pedo.
Okay, sir. So like if I am choosing perio branch, like there are few colleges that I'll be getting in a government setup, sir. So for me, I cannot go too far from my home, sir, because of some of my family concerns. So I I am from the northeastern part, and I am thinking of colleges close to my area, like Eastern India or Northern India, or maybe Central India, like maybe West Bengal, maybe UP, maybe Delhi. Delhi, it's not possible, I guess. So,
See, I
according
would
to you,
advise you, whichever college you're taking, just see the scenario of the college, because in perio, if you take a college that does not have a exposure, because I've seen a lot of government colleges in perio where the exposure is not proper, there are no implants, then I would advise you to look for another preference. So it is not according to the location. Okay, if the location is a preference, but still try to locate those colleges nearby which have all those things, good perio exposure, especially the perio surgeries that are soft tissue surgeries, because your surgical skills depend upon that, and especially your implants. So these two things, if some colleges are offering you and the HOD is active, the teachers are active to teach you, then your preference would be to go for that college nearby. So you need to see nearby which are colleges are there and try to see which are offering all these things.
okay, sir. Sir, how can I know about the internal things about the department from a
So
college?
first you need to find out all the list of the colleges. Okay, and then it's very simple. If you just put the name of the college on social media. Also, you can find out the PGs or other teachers or doctors, and they're ready to help out, help you out. And still, if you find that at near your rank that these are the colleges that you get, there's no problem if you can just go and visit those colleges once, at least 2-3 colleges, whichever your is your more preferable colleges that you're about to get, and you think you can get at your rank. So you can just go and visit those colleges also, because I still remember during my time I visited a lot of colleges before deciding. Because it's next 3 years that would decide a lot of your career and a lot of your things. So if you can then just spend some time doing that, this is an advice to all of you. especially some of the colleges that can come at your rank, I would advise you to go ahead and do that. And one more thing I would tell you, please just don't get demotivated with people that this branch is bad, this branch is worse. Every branch is good. I have seen people in oral pathology. I know just doing with oral pathology work, they are earning it more than 7 figures. And so every branch is good. It is your hard work for next 3 years that would define your future. Even if you get an endo and oral surgery and ortho, but if you're not working hard for next 3 colleges, it would be of no use after 3 years. So if you want to differentiate yourself, just focus upon right now what you're getting. Obviously, you should choose your preference of branch and work very hard for the next 3 years. And believe me, the things are very good after 3 years when you come out.
Okay, sir. Thank you so much, sir.
Thank you.
Okay, do we have Aseng with us? Aseng, if you're there? Aseng, Komal, Mitanshi, if any one of you are there, you can please ask your questions. Okay, I think they're not there. So, any other doubts, or shall we wind up? If there are any doubts, you can please ask right away. All right, there is a question in the comment section. Sir, if height is short and gender is female, if it affects OS, I've heard from many people that for a girl, it is difficult OS field. Okay, I'll just take this and then I'll ask Kapil sir to also take this question. There is no such thing that a female cannot do OS. I am here. All right, I have completed my fellowship also after MDS. There is no such thing. It is a mindset. The society's work is to feed you something and you buy that. If you are, like sir said, if you're passionate about your branch, like Kapil sir said, if you're willing to work hard, if you're willing to burn the midnight oil, no branch is less or superior or inferior to each other. It is all in your head. It is all a mind game. There are so many females who are doing oral surgery currently. Yes, the trend has shifted. It was a male-dominated field few years back. Now no longer it is. And trust me, as a female, you can do all the surgical procedures that your male counterpart can do and equally efficiently. It is nothing like that. A male can do it better, female cannot do it better, or vice versa. It is nothing like that. Okay, if you are passionate about the subject, yes. One thing that differs in OS is there is a little more hard work in comparison to the other branches in terms of your emergencies, your calls. You will have to be, even after completing your MDS, you will have to be available. There might be a trauma case in the middle of the night. The hospital will give you a call. You will have to go and see your patient. You will have to go stay awake, suture your patient. All right. So, and once you have done a major surgery, there will be post-operative complications inside the ICU, in the ward. So you will have to be available 24/7 for your patient. So when you are doing OS, just keep this thing in mind. Okay. And rest, I would also like sir to clarify on this.
Yeah, like Dr. Smriti said that, so first of all, it's never gender biased. So our gender never defines a branch. Just think what you're doing. Being a doctor, our role is to treat a patient. So how does it make a difference that a male or a female doctor is treating a patient? So first of all, again, I will tell you that if you're passionate about doing an oral surgery, then just think I would be the best oral surgeon in the world. And I will do everything in next 3 years to be the best. And one more thing to just make you clear to everyone, it is just not these 3 years. Once you become a doctor, and even if you're done a post-graduation, we are still learning. I still travel all across the world to learn and to upgrade my knowledge. So it is a never-ending process. And every day, every year, when I think myself 10 years down the line, when I started my practice, I used to think I was good. But today also, I think I could even be better. So just remember, it's a learning process, and your gender and your height, this is not an excuse. There's no point of even thinking this would create a difference. But I always believe surgical branches creates a slight stress, because when you do a surgery, there could be a complication that can come that creates a stress. But with time, if you're good, you know how to manage those complications, and those stress are just part and parcel of your life that comes with any branch. So I would again tell you, just focus upon what you want to do. If you want to do a oral surgery, just don't think about the rest of the things. Work hard, and if you get a good branch, whatever branch you get, to all of you, just work hard for next 3 years, and believe me, things would be very, very good.
I hope your doubt is clear, Xiaomi. Okay, Dental Bud, ma'am, which fellowship you have done? I have done my fellowship in head and neck oncosurgery after my MDS. So I think everyone has asked their doubts. We can answer, we can wind up this session. Wishing you all the very best. We will be... Yes, any questions? Samriddhi, you want to ask any question?
You are doing head and neck oncosurgery. Some seniors have said that it will be competition for MCH in head and neck oncosurgery. With they are get preference in any hospitals. Sorry for asking, but
Yeah, see, preference will be always be there for them, but you can, again, like sir said, you can create your own niche. If you're good at it, I have, for maxillectomies, I have MCH people asking me their doubts how to go about a maxillectomy, because they are from ENT background and they are still, they have their own doubts. All right, so you have to see, I always say your practice should be multidisciplinary and your egos aside. So only when you can do that, there are, again, in the market, many MCH people are ready to collaborate, many are not. So those who are not ready to collaborate, forget about them. Those who are ready to collaborate, you do a give and take. You give some part of your knowledge, you take part of the knowledge, team up, do the work. All right. So you will come across all sorts of people professionally. You have to identify your own team up and do the good work in the best interest of the patient. This is what we are here for as clinicians, as doctors. So nothing else matters. I am here in Delhi NCR. I get referrals. So it does not matter. Okay. It is you have to be, when you know you're good at something, you have to be confident.
Okay,
any other questions? Samriddhi, any question you had?
Yes, ma'am. Ma'am, I want to ask after MDS, can we do SRship in perio?
Yes, sir will answer that for you.
Sorry, I didn't get your question. Can you please come back?
Sir, after MDS, can we do SRship in perio?
MDS in which branch? In perio only?
Perio, yes, sir. So after
Yeah,
MDS.
you can do that. But why do you can do that SRship? But if you want to go and attend a government college for a job per se, then you can do it. But otherwise, there's no point of doing it. There's nothing different you will learn. So still, if you want, you can go ahead and do it. There's no problem. There's no restrictions to do it.
Okay, so there is no difference in an MDS and also in SRship. Like nothing new is there in SRship.
Yeah.
Okay. Thank you.
So I think we can wind up the session. I wish you all the very best to everyone. We will be available to answering your doubts during your phases of counseling. So please feel free to connect with us. And my best wishes to everyone.
All the best, students. Take care. Have a very good night. Bye.
Thank you. Thank you for joining in. Good night.